Hello and welcome to Open Up, a practical guide to improving pet oral health. This educational resource is brought to you by Hills Pet Nutrition, iM3, the veterinary dental company, with the expertise of the Australian Veterinary Dental Society. It has been estimated that over 80% of dogs and cats have some degree of periodontal disease by 4 years of age. In the USA, gingivitis and calculus are the most common disorders reported during clinical examinations. This was a finding from a national companion animal study of over 31,000 dogs and 13,000 cats. Periodontal disease can cause local infection and destruction of the oral tissues. But the release of inflammatory mediators and bacteria into the bloodstream has even more widespread health implications. Periodontal disease in man has been identified as a risk factor for coronary heart disease, stroke and preterm low birth weight babies. In dogs, it's been associated with pathological changes in the liver, kidneys and heart. The Australian Veterinary Dental Society aims to educate veterinary professionals as well as pet owners about the importance of oral health in our pets. In pursuit of this aim, the AVDS has produced a document entitled Canine and Feline Dental Guidelines. This resource is based on those guidelines. Periodontal disease often goes undetected by owners, yet it can be a chronic, painful and debilitating disease that can lead to reduced quality of life and even in some circumstances death. Periodontal disease can be prevented by combining a good home care program with regular oral examinations. Optimum home care would include daily toothbrushing and the use of clinically proven dental diets. Regular professional cleaning would also be an important part of the management of this disease. This resource has been produced to help you, the clinician, improve your skills in diagnosing and treating periodontal disease as well as other oral disease in your patients. This will help lead to better oral health and also improved quality of life for pets under your professional care. And that's what we all want.
That's a good girl. All right, give me the ball. What's going on in there? You've got a bit of a stinky breath. You've got a bit of a stinky breath. We better check that out. That's a good girl. That's a good girl. Sit down, Sybil. Sit. Oh, good. Good girl. What's been happening in here? Let's have a look at your teeth today. Check of your teeth. Oh my goodness, look at that. Builder. Oh, that's not good. Come on, we'll ring the vet. Hi Hazel, how are you?
Good, thank you. How are you?
Good. I brought Sybil in for her dental today.
Okay, great. All right, thank you. Thank you.
Okay, I'm just going to check Sybil out before the vet comes in today. Is she having any trouble eating her food?
No, not really.
And what are you feeding her?
Just dry food.
Are you doing anything to help keep her teeth nice and clean?
Oh no, I didn't know I had to.
Okay, that's all right. What I'm going to do is just do a quick physical examination. So I'm going to check her heart and her lungs and take her temperature as well.
All right.
And I'll also check her teeth over.
Okay.
And what I'll be doing is popping a stain to see if any plaque shows up.
Oh, good.
I'll just go and let the vet know that you're here. It won't be long.
Thank you.
Hi Margaret, how are you going?
Hi.
I'm Christine Hawke. I'm the vet that's looking after Sybil today.
Thank you.
Hello Sybil, how are you doing?
She's a good girl.
She's lovely, isn't she? Now Alicia was telling me that Sybil's got some oral disease.
Oh, is that why she's got bad breath?
It's the most likely reason. They get plaque bacteria building up on their teeth and that causes bad breath, but it also causes periodontal disease.
How do I get rid of it?
Well, to get rid of the bad breath, you need to get rid of the plaque. So it's a combination of professional cleaning and home care. And it's really important that you do follow up with care at home to keep the plaque down to stop the problem from recurring. Yeah. So what we need to do is have a good look at her mouth and check out what's happening. just have a look at your teeth and your gums. That's the girl. The other side. Good girl. That's it. Have a look at your tongue. Good girl. Okay, well done. Well, Sybil's got quite a lot of plaque and tartar on her teeth, and so I think for her the best thing would be for her to be anaesthetised so that we can get a really full examination of what's happening, and we can professionally clean off all of the plaque and tartar that's there at the moment. It also lets us find if there's any other disease there, and we may need to take some x-rays to do that as well.
Is that really necessary? Could I just start with the home care and see how we go with that?
Yeah, it's probably not the best thing because the plaque and tartar that's already there won't be removed with home care. So what we'll need to do is get her mouth back to healthy, and once it's healthy you can do things at home to maintain that. The other problem is that if she has got gum, she has got gum disease and it's painful, if we start trying to brush her teeth at home, then that could cause her some distress.
I've heard that the gum disease can lead to heart disease. Is that in dogs, is that right?
Yeah, well, there's evidence in humans definitely that heart disease and gum disease are related. So in dogs the research is still ongoing, but there does appear to be links with kidney and liver disease as well in dogs. So it's much better to treat it now before she gets problems than to wait.
Okay, that makes sense to me. I want to do the best thing by Sybil.
Okay, the other thing to let you know is that we may need to contact you through the day if we do find any other disease in her mouth while she's under the anaesthetic. Have you got any other questions?
No, I think you've covered everything. Thank you.
Great. Okay, well, Sybil, we'll go and get you ready for your operation.
Okay.
Once we have Sybil under general anaesthesia and we've thoroughly examined her oral cavity, we need to place a pharyngeal pack to protect her airway from fluid and debris. We can then apply plaque disclosing solution to make it easier for us to visualise the deposits on her teeth. What this solution does is to stain the plaque on her teeth a pink colour. So we simply paint the plaque disclosing solution onto the tooth surfaces, making sure we cover all areas, and we rinse the excess off using a triplex. We can then remove any gross calculus deposits using calculus forceps or extraction forceps. Doing this will make examination of the teeth and ultrasonic scaling more effective. Next, we can use the periodontal probe to measure the depth of the gingival sulcus, so we can detect any abnormal periodontal pockets. It's important to check the depth around the whole tooth. The normal probing depth for dogs is less than 3 millimetres and for cats is less than about 1/2 to 1 millimetre. These probing depths can then be recorded on the dental chart. Any gingival recession or hyperplasia can also be recorded, as this information helps us determine the degree of attachment loss. Once all findings have been recorded, you can review the chart and develop a treatment plan to address any abnormalities. You may also need to contact the client at this stage to obtain informed consent. Before scaling, we rinse the oral cavity with chlorhexidine solution, and this decreases the amount of bacteria that's aerosolised. So here we're using the ultrasonic scaler. We use the side of the scaler tip, not the point, to remove plaque and calculus from the teeth. It's more efficient if you use a fairly light touch, as using a lot of pressure will dampen the oscillations and make the job harder. It's also important not to spend more than about 10 seconds per tooth, because you can overheat the tooth and damage the pulp. You can always go back to the tooth later to finish the job. Hand scalers are then used to remove any deposits that can't be effectively cleaned using the ultrasonic scaler. To protect the soft tissues from the ultrasonic scaler and to give yourself better visualisation of the back part of the mouth, you can always use a Minnesota retractor. It's also very important to gently scale under the gingival margin to remove any subgingival plaque and calculus from the gingival sulcus. For deeper periodontal pockets, we usually use hand curettes. Polishing removes any residual deposits and leaves a smooth surface that makes it harder for the plaque to reattach. Make sure there's always prophy paste in the prophy cup to avoid overheating the teeth. To polish subgingivally, you can flare the edge of the prophy cup by applying pressure. Once all the teeth have been polished, use the triplex to irrigate and flush any remaining prophy paste and debris from the gingival sulcus. Finally, check the oral cavity for any debris or fluid before removing the pharyngeal pack.
How are you?
Hi Margaret, she did really well.
Oh, that's good.
She's been a very good girl. She coped with the anaesthetic without a problem, and we did her dental procedure and that went without any problems as well. As I explained to you on the phone yesterday, she did have a few findings, so we'll go through those again now. I've got her chart here. She had quite a lot of tartar and plaque on her teeth and a fair amount of gingivitis. So what we've done with all of her teeth after we examined them was to scale and polish and get all of that off so that she can get back to a healthy mouth. The one finding we did have was that extra little tooth that we noticed. So we took that out. It was a very simple extraction and should heal very quickly. The main reason we needed to take it out was because it was causing crowding with the rest of her teeth, and so she was getting a lot of plaque build-up. And so having that out of the way now will make keeping her major teeth in much better health a lot easier.
So what do I need to do now?
Well, now that we've got all the plaque off the teeth and we've got them back to a healthy state, it's up to you to try and keep as much plaque off at home as you can to slow down any more disease and the bad breath from coming back. So with anti-plaque products, there's a lot of things on the market. The two basic ways they work, one is mechanical, where you've got a product that removes the plaque from the teeth, and in humans the main way we do that is toothbrushing, and we can certainly do that in our pets as well. There's also special dental diets that are designed to clean the teeth as they chew. So with the chemical forms, it's like in a person we would use mouthwash. So in dogs there are rinses and things that you can use as well. I guess the main thing is because the plaque is a physical build-up on the teeth, you want to mechanically remove it if you can. So it's good if you can have at least one mechanical type of plaque removal, and then you can use the chemicals to back that up. That's the best way to control it.
So what sort of toothbrush and toothpaste should I use?
Well, with toothbrushes, there are some that are designed for dogs and cats, and the main thing with them is that they're very soft. When we brush our teeth, we can feel how hard it is on our gums, but with dogs it's quite easy to press too hard. So they're designed very soft. They're also often designed to get up to the back of the mouth quite easily because their mouths are a lot longer than ours. You can use human toothbrushes, but again you'd go for the really soft ones. So often the ones designed for children are really good for pets. With toothpaste, the main thing is not to use human toothpaste because humans will rinse and spit, whereas dogs will swallow anything that you put in. And the amount of fluoride in human toothpaste can actually be toxic if they swallow a lot of it, and it can upset their stomach. So they don't need fluoride as much as we do because they don't get as many problems with holes in their teeth and cavities as we do. So the dog ones come in all different flavours too, like chicken and beef and fish. So, you know, strange as that sound, it actually makes it easier to brush their teeth because they like the taste of it. The other thing to keep in mind is that there is an organisation called the Veterinary Oral Health Council, and they put seals of approval on foods that are clinically proven and scientifically proven to control plaque and tartar. And the Hills prescription diet, TD, has been scientifically proven to do both of those things to control both plaque and tartar.
Can I start feeding Sybil the food straight away?
Well, like with any diet, it's better to transition it over a few days. So go from what you're feeding now straight over to the TD over a period of 7 to 10 days. And that'll allow her to adapt to the new texture and the size of the kibble. The good thing about this diet in particular is that it's a complete diet, so you can feed it just as the sole food.
What about bones? Do they help with cleaning her teeth?
Well, there's actually no scientific evidence that they do help control plaque. One of the things with bones that is a big problem is that a lot of dogs do break their teeth on them. So we do spend a lot of time taking out teeth that are otherwise healthy because they've been damaged by bones. They can also cause other problems like stomach upsets and obstructions, and sometimes they can have bacteria in them as well that can make the dog quite sick. So a safer option, there are a lot of chew toys and treats out there that are probably a little bit safer for dogs.
I will try the brushing and the dental food. It's good to know I can combine both because I'm not sure how easy it's going to be to clean Sybil's teeth.
Yeah, no, I understand it is quite difficult in some cases. It's not always as easy as we make it sound. The thing is that if you've got an animal that doesn't like it, really doesn't like it, and is either being aggressive or whatever, the main thing is we don't want either of you to get injured. So if it's not working, that's when you would need to rely more on a dietary form of removing the plaque. In her case, she's such a sweet dog and she seems to be very good about being handled around the mouth. I think if you can get it going and persevere with it, it's going to have enormous benefit for her.
When do I need to bring Sybil back to see you?
It'd be really good to see her in about 4 weeks' time, because that gives us time to see how you're going with the home care and with the brushing and the diet, to see whether you are controlling the plaque quite well. The nurse will give you a call tomorrow to check how she's gone from the anaesthetic, and when you're talking to her, she'll be able to give you a lot more tips on how to brush Sybil's teeth and how to transition the diet.
I've got one more question. We've recently adopted a cat. She's 12 months old. Can I use the same dental food that I'm feeding Sybil?
Not really, because cats and dogs have got very different nutritional needs, and so something that you feed to a dog won't actually meet all of a cat's requirements. The good news is that they do make the diet in both cat and dog forms so that you can get a different one for each of your pets. Best thing to do before you start anything is to bring your cat in so that we can have a look and check what condition the gums are in, because depending on what's going on in the mouth will depend which type of diet we recommend. Okay, so I think that about covers it. Is there any other questions that you've got?
No, I think you've covered everything.
Excellent. Okay, well, we'll look forward to seeing you and Sybil again in 4 weeks.
Great, see you then.
Okay, bye-bye.
Bye.
I hope that you've enjoyed watching this educational resource and that it has been a worthwhile introduction into the world of veterinary dentistry. This resource has been produced to emphasise the importance of oral health in the overall health and well-being of our patients. All of the procedures and techniques shown here can be performed by you, the practitioner, with the assistance of your veterinary team. The take-home message is that as practitioners we need to recognise oral disease early, as well as informing our clients of ways to prevent or control this chronic disease. Whilst compliance can be challenging, there are a number of steps that can be taken to ensure better compliance for maintaining oral health. A good start would be to include the whole veterinary team, from the receptionist through to the clinician. The team would stress the importance of prevention of oral disease by recommending, number 1, toothbrushing, 2, the use of clinically proven dental diets, and 3, regular dental checkups. There are many ways to drive awareness of oral health in your practice, such as running a number of dentally focused promotions throughout the year. Don't forget to use a reminder system for clients to return for dental checkups, as your own dentist would do for you. Waiting room displays such as smile books and oral health product displays are also helpful. Watch your practice grow with the positive effect of your care and recognition of pets' special needs. I would like to draw your attention to a number of websites that will assist you in furthering your veterinary dental knowledge. Finally, I would like to thank the organisations that made this all possible. Hill's Pet Nutrition, iM3 the Veterinary Dental Company, the Australian Veterinary Dental Society, and the University Veterinary Teaching Hospital, Sydney, at the University of Sydney, where the procedures were performed. Hello, my name is Dr. Anthony Caiafa. Today we're going to talk about veterinary dental radiology. Veterinary dental radiology is a very important component of veterinary dentistry today. The reasons why we need to take radiographs inside the mouth are mainly due to periodontal disease, which is bone loss around the caudal teeth in this model here. And a radiograph will show that up quite nicely. Also, because most of the tooth is below the gum line, radiographs will show up more pathology. Other reasons we need to take radiographs is in cats we have resorptive lesions which can occur below the gum line. To take intraoral radiographs, we need to have a veterinary dental X-ray machine. Veterinary dental X-ray machines are important because they have vertical angulation and horizontal angulation. You can use a standard veterinary X-ray machine as well, so long as it has the same features. We also need to use dental X-ray film, such as this. This is a DF58 type of film made by Kodak, and this is a DF50 type of film made by Kodak. This is called size 2 film, and this is called size 4 film. Dental X-ray film has a raised dot, and this raised dot allows you to position the film in the correct position. That raised dot allows you to orientate the film firstly on the viewer, so with the raised dot pointing towards you as you're viewing the film, and secondly it allows you to orientate the film on the left and the right hand sides of the animal. To open the film, we lift the flap up like this, we pull it back, and we pull the interior out. It has a lead backing. This helps prevent scatter. It also has a black cardboard interior. This also protects the film from light. And then on the inside, this is the actual film, and this is the film that needs to be processed. There are two techniques that we use to take intraoral radiographs. The first technique veterinarians would be very familiar with. That is the parallel technique. In the mouth, it can only really be used in the caudal mandible. So we place the film beside the molar teeth. You can use gauze or cotton rolls to support the film in its correct position. And then you bring the tube head in. We can shoot at right angles, and then you take the radiograph. Into the mouth, beside the molar teeth. We're going to pack and hold that film in its correct position. Like such. And then we're going to come in and take a parallel view of those molar teeth. The second technique we use in veterinary dentistry is called the bisecting angle technique. Apart from the caudal mandible, this technique is used in all other places of the mouth. To take a radiograph of the maxillary canine tooth, we place the film inside the mouth. To take the bisecting angle technique, we utilise sticks or pencils as such. If we're taking a radiograph of the maxillary canine tooth, the long axis of the maxillary canine tooth is like so. The long axis forms an angle with our film. If we bisect that angle, we can shoot at right angles to that bisected angle. So we bring our collimator in and shoot at right angles to that bisected angle. And that will give us a one-to-one image of the maxillary canine tooth on our film. Taking intraoral radiographs is very important in veterinary dentistry. It will show a lot more pathology than you will see in a clinical examination of the oral cavity. Veterinary dental radiography is a vital component of veterinary dentistry today. I would recommend it highly to all veterinarians to consider veterinary dental radiography as a component of their examination of the oral cavity.
I'm Christine Hawke, and I'm going to show you some local nerve blocks, so showing you the landmarks that you can use to do local nerve blocks of the oral cavity in dogs. So the first ones that we're going to do are the upper teeth or the upper arcades, and depending what you want to block, there are some different places that you can put your local nerve block in. The first one is the infraorbital block, or the cranial infraorbital block, and what we're blocking there is all of the teeth along here back to the third premolar, and the landmark for it is the infraorbital foramen, which is just usually located above the third premolar. And so what we do, you can actually palpate that through the oral mucosa of a dog. So if you were to lift the lip and feel, you'd be able to feel that foramen there. And what you need to do is insert the needle into the foramen, because once the nerve has come out of there, it's not actually innervating the teeth. So once you palpate this above the third premolar, what you would do would be to introduce your needle just like that. Okay. And then you draw back, check you haven't gone into a blood vessel, put your finger or thumb over it as you inject and hold that for 30 seconds. And what that will do is do the outside and the teeth, the pulp of the teeth as well. If you're using that and you need to block the palatal side as well, so if you're doing an extraction, then you would need to combine it with the palatine block. And the way we do that is to do the major palatine nerve as it comes out of the palatine foramen just there, so it would run down there. And to find this, you can't palpate this in a dog, but usually it's at the level of the distal cusp of the fourth premolar, about halfway between the midline and the tooth. So you can see that there. And what you would do would be to introduce your needle from the front and just introducing it cranial to where that is, and then just introduce it like that. The other nerve block that you can do to block the whole maxillary area on one side is the maxillary nerve block. So what you're doing is blocking the maxillary nerve before it runs into the maxillary canal and before it branches off and supplies the caudal teeth in this area. So to do this, we generally need a much longer needle in dogs. So usually we'll use a 1.5 inch needle. And we pre-bend it. There's a couple of ways you can bend it, either sort of at a 30° to 45° angle full length, or some people like to bend it halfway. To do the maxillary nerve block, you need to block the nerves as they're running towards the teeth, as they run through the pterygopalatine fossa area. So you need to introduce your needle behind the second upper molar. So that's the last tooth. If you feel that intraorally, you can then introduce your needle behind there and hopefully catch the nerves as they're branching off into each of these foramina. So to do that, as I said, we bend the needles so that we can get good access. And what you want to aim for is to introduce the needle about mid-crown across the width and aim it up, walking along the back of the bone, the alveolar bone, and you want to aim to deposit your local anaesthetic at about the depth of the apices of those caudal molar teeth. So you'd introduce it like that, and then you should be able to inject. You can get hemorrhage from the venous plexus in that area, so just take care when you're doing it. So that covers the main nerve blocks for the maxilla. For the mandible, there's two blocks that we tend to use routinely, the mental block and the mandibular block. So for the mental block, what we're aiming to do is to block the nerve supply to the teeth, the incisors and the canine. And to do that, we use our landmark, which is the middle mental foramen, which is this hole right here. In large dogs, you can usually palpate it, but in small dogs, it can be very difficult to feel. The main landmark on the outside that you can use if you can't feel it is the frenulum that holds the lower lip on. So it's usually around the middle area of that frenulum, under the area of the second premolar. So what you would do for this, because the frenulum is in the way, would be to introduce your needle rostral at the rostral end of the frenulum, and then try and introduce it. It's around the middle of that frenulum area. So you would introduce it like that. You need to enter the mental canal because the nerves to the lower teeth come off from inside the mandibular canal, and so if you just deposit your anaesthetic here, you'll just be desensitising the lip. For the mandibular nerve block, what we're aiming to do is to block the mandibular nerve before it enters into the mandibular canal at the mandibular foramen, which is this foramen here, and it's on the inside of the ramus of the mandible. So what we'll get if we do that is we'll get desensitisation of all of the teeth in this arcade and all of the tissues in that arcade. Now, to find where this foramen is, we can do two types of approaches. We can do an extraoral approach where we inject from outside of the mouth, or we can do an intraoral approach where we introduce the needle inside of the mouth. To feel where this foramen is, one of the easiest ways is to feel the mandibular notch, which is palpable in most dogs, and it's this notch here just at the caudal end of the mandible. It's usually around the level of the lateral canthus of the eye, and so you can feel that, and if you feel where that notch is, that is the level that the mandibular foramen is at. Height-wise, what you're looking for is it will be about halfway the height of the ramus of the mandible at the level of the first molar. So to do this in most large dogs, you would need to use one of the longer needles, and so you would direct your needle and walk it up the inside of the mandible to the level of halfway of the width of this bone here. And if you do that, you'll be coming right where that nerve's entering the mandibular canal. If you can't feel the mandibular notch, another way to locate where the mandibular foramen is likely to be is to introduce one hand into the mouth and feel where the third molar is, and to feel where the angular process of the jaw is. So that's the most caudal ventral point of the jaw. And if you were to draw a line between those two points, the mandibular foramen lies pretty much smack bang in the middle of that line. So once you've got this line worked out and you know that the mandibular foramen is lying about halfway along that, you can then introduce your needle extraorally and walk it up the inside of the mandible, and again to the distance that is about half the height of the mandible at the level of the first molar. The other approach you can take is an intraoral approach, and the way you do that is some dogs, again in large dogs, you may be able to palpate the foramen with your finger inside the mouth, and so you can aim for that. Otherwise, you can use your third molar and your angular process to work out where that line is, and so where you would approximate the foramen to be. And then what you would do is introduce your needle behind the last molar and advance it along that line to the point that is halfway along that line. And so walking along the bone, and then you would be able to withdraw to make sure you haven't entered a blood vessel, and then inject. With a bit of practice, local nerve blocks are quite easy to do, and for any dental procedures that you're doing, it really does make the anaesthetic a lot smoother, and it's also great for the post-op recovery for the animal.
This film will look at the equipment and steps involved in performing a simple tooth extraction, including pain management. The equipment required for a simple tooth extraction would include a Minnesota retractor, various sizes of dental elevators, and extraction forceps. And now we're going to take a radiograph of the upper premolar tooth that we are going to extract. This tooth is a supernumerary tooth. We place the film into the mouth as such, and we're going to use the bisecting angle technique to take a radiograph of that premolar tooth. To extract the upper premolar tooth, we will give an infraorbital block. This will block the infraorbital nerve. This will give anesthesia to the premolar teeth, canines and incisors on that side of the mouth. The infraorbital foramen is usually level with the distal root of the upper third premolar. Finger pressure is applied to the foramen whilst injecting. Finger pressure is also applied once the needle has been removed, and this will allow for infiltration of the local anaesthetic agent along the canal. We will also give a palatal infiltration around the tooth to be extracted, and this will give anaesthesia to the mucosa around that tooth. To extract the tooth, the dental elevator is applied to the mesial side of the tooth and in a rocking action moved along the root. This will stretch and tear the periodontal ligament fibres. The elevator is then applied to the distal side and again with a rocking action worked along the root. We can then rotate and hold with the elevator for 10 to 15 seconds. This will tear periodontal ligament fibres and cause bleeding within the alveolus. Once the tooth is loose, extraction forceps can be applied. The premolar tooth root is conical and will accept rotational movement. When the tooth is extracted, check the apex. The apex should be smooth and rounded. For pain management for a simple and surgical tooth extraction, we would like to use the so-called preemptive analgesia or pain relief. We'd like to give a preoperative dose of an opioid such as methadone, an intraoperative dose of a local anaesthetic agent such as lignocaine hydrochloride, and a postoperative dose of either an opioid or a non-steroidal anti-inflammatory drug. This film will look at the equipment and steps involved in performing a surgical tooth extraction. The equipment required for a surgical tooth extraction includes Minnesota retractor, size 15 scalpel blade and handle, fine tissue handling forceps, periosteal elevators, a dental workstation with high-speed handpiece, preferably with a fibre optic light, iM3 round and fissure burrs, 3/0 or 4/0 absorbable suture material. The steps involved in a surgical tooth extraction. Firstly, a lateral radiograph using the bisecting angle technique of the upper canine tooth is taken to look for any other pathology below the bone level. Here's the lateral radiograph of the tooth in question. The upper canine tooth has a complicated crown fracture with a necrotic pulp. Here the dental explorer is placed into the pulp exposure. The maxillary block is given with a local anaesthetic agent. The block is given behind the last molar tooth. This will block the palatine nerve and infraorbital nerve, giving anaesthesia to that side of the upper jaw. It is advisable to clean plaque and tartar off the tooth prior to extraction. The flap should be designed with a wide base to protect the blood supply to our flap. Our flap is started with 2 lateral releasing incisions, one on the mesial side of the tooth and one on the distal side. These incisions should be made over sound bone, in sites where bone will still remain for subsequent suturing. A horizontal releasing incision into the gingival sulcus is then made, and with the use of fine tissue forceps and scalpel, the flap is then begun. Once the flap has been started, we then use a periosteal elevator to lift our mucoperiosteal flap off the bone. With a high-speed handpiece and round burr in place, an outline is made into the bone to be removed over the root of the tooth. Make certain that you have a good water supply to the tip of the burr to prevent overheating of the bone. The buccal bone is then removed over the root of the tooth. It is a good idea to place troughs into the mesial and distal bony plates for easier placement of the dental elevator. Remember to choose the correct size elevator for that root. Due to the partial ankylosis of this canine tooth, more buccal bone is required to be removed. As for a simple tooth extraction, the dental elevator is placed into our troughs, and the tooth is elevated in a rocking action along the root of the tooth, on both the mesial, distal and palatal sides of the tooth. The elevator is applied to the palatal side of the tooth and rotated and held for several seconds. This will tear the periodontal ligament fibres and also cause hemorrhage within the alveolus. Be careful when elevating on the palatal side that you do not force the apex of the tooth through the medial or palatal plate of bone, thus causing an oronasal communication. Apply the extraction forceps in a mesial distal direction. At some point, the tooth will accept some rotation. However, avoid rotating too forcibly. The tooth is then delivered. When the tooth is extracted, check the apex of the tooth. The apex should be smooth and rounded. It is advisable to smooth over any bony edges before suturing the flap closed. Curette out any debris from the socket, being careful on the palatal side of the socket. Gently flush the socket with saline, making certain that no saline drains from the nose. This would indicate an oronasal communication. To allow for tension-free suturing of the flap, a releasing incision is made into the periosteum of the flap. We then suture the vertical releasing incisions with a simple interrupted pattern, ideally using a 4-row absorbable suture. The horizontal component of the flap is then sutured. This will hold the blood clot which is forming within the alveolus. For post-operative care after extraction, the owner is told not to lift the lip and advised to feed the dog small pieces of meat. Chlorhexidine rinse can be used until the reintroduction of toothbrushing in 5 to 7 days. It is advisable to schedule a recheck visit 1 week later. Dry food can be reintroduced after the 1-week recheck visit. For pain management for a simple and surgical tooth extraction, we would like to use the so-called preemptive analgesia or pain relief. We'd like to give a preoperative dose of an opioid such as methadone, an intraoperative dose of a local anaesthetic agent such as lignocaine hydrochloride, and a post-operative dose of either an opioid or a non-steroidal anti-inflammatory drug.
iM3 is a veterinary dental company that designs, manufactures, sells and services state-of-the-art dental machines, hand instruments and dental consumables for the veterinarian. Our equipment can be found in veterinary hospitals and teaching universities throughout the world with a reputation for quality, functionality and unique features. Let's take a look at the dental equipment used in these films. Unlike other ultrasonics 2-scalers that use a conventional scraper or jackhammer approach to 2-scaling, the 4212 adopts a more gentle technique. It utilises a revolutionary rotational tip movement and high ultrasonic frequency to remove plaque and calculus quickly with less enamel damage and less heat. This is similar to an ultrasonic instrument or jewellery cleaner in the way it works. The 4212 can be safely used subgingivally up to 13 millimetres with little or no enamel damage. The tip is made from titanium and is totally round with no sharp sides. The whole shaft is active, unlike a piezo or a cavatron where you use either side. The 4212 is controlled by the switch on the handpiece, eliminating the need for a foot pedal. To operate the scaler, simply turn the unit on at the back. Adjust the power levels. We would recommend 3 to 4 lights for general scaling. And activate the switch by pulling the ring back. Once you've activated the switch, simply adjust your water flow so you get a nice mist. We would also suggest before scaling the teeth that you apply IC plaque, a plaque disclosing solution. This allows plaque to become visible and will reduce the time it takes to scale and ensure you remove all the plaque and calculus during the procedure. To maintain the 4212 scaler, you should clean the exterior surfaces. You can autoclave the handpiece and tips complete with a ferrite rod. Remember to remove the silicone switch protector when autoclaving the handpiece. Use distilled water to prevent minerals and contaminations in the coolant supply. When the scaler is being used, we recommend the operator use the corian pad. Place it next to the animal's head, and when not using the scaler, clip the handpiece in. This prevents the handpiece dropping to the floor and breaking the ferrite rod. If it does break, you'll need to change the ferrite rod. The tools required are supplied with the 4212 and you also receive a spare rod. Now let's look at the Elite air-driven dental machine. The following features come standard on this machine. A built-in corian top. This is impervious to bacteria and viruses and is easy to clean. It features a built-in magnetic burr holder to prevent the burrs from falling on the ground. Has an autoclavable venturi suction controlled by the foot pedal. The Elite features a 3-way syringe or triplex. This delivers water, air, or a mist. It can be useful in washing the animal's mouth. The machine features a 2-bottle coolant system. 1 bottle is for distilled water and the other for CLS solution. CLS is our chlorhexidine-based solution. With a simple flick of a switch, the machine will deliver either water or CLS. This is handy to wash out the animal's mouth at the start of a procedure. The spearmint will mask any mouth odours. When you select water or CLS, this will be delivered to the 3-way syringe, the ultrasonic scaler, and your high-speed handpiece. CLS is the only chlorhexidine-based solution that can be added to the water supply of a dental machine without blocking it. Regular chlorhexidine will. Our new Advantage low-speed handpiece has been ergonomically designed to be lightweight and shorter than other handpieces. This helps to reduce fatigue and makes it less cumbersome. The R&R oscillating prophy cups are fitted to the straight nose cone. The advantage of the rock and roll is that they oscillate as opposed to just spinning around, so they won't catch muzzle hair or generate excessive heat. The rock and roll is pre-lubricated, which minimises maintenance and it is disposable, which eliminates cross-contamination. The high-speed handpiece is fitted with fibre optic lighting. This illuminates the burr and the area you're working on, and it's great in a cat's mouth. The high-speed burr is working at 400,000 RPM and is water-cooled. This allows for fast, accurate sectioning of teeth and removing of bone. iM3 has developed a unique CLS flush system for the high-speed handpiece. When you remove your foot from the pedal, the dental burr continues to run. This causes a suckback, which results in blood and debris entering the head of the handpiece. To reduce the risk of cross-contamination between patients, you simply press the flush button for 1 to 2 seconds and then operate the handpiece. This injects the CLS into the airline and flushes out the line in the handpiece. This is the next best thing to autoclaving. We still recommend that all dental handpieces and burrs are autoclaved between procedures. All the water lines have filters, and all of our exhaust air lines have bacterial filters. This ensures that the air being released back into the working environment is clean. This is great for OH&S standards within your practice. The iM3 system features a large, powerful air compressor. The large size of the tank reduces the time the motor has to work, and this means it won't overheat during dental procedures. Our stands are adjustable in height and made from stainless steel. The chassis is made from aluminium, so it won't rust and features a hospital-grade powder-coated finish. The machine's available on wall arms or with remote compressors. iM3 dental machines are designed to provide many years of dependable service. They are built to last and easy to maintain. All iM3 dental machines have the maintenance instructions printed on the machine. This means that you can quickly refer to the instructions without having to search for a manual. The high speed and low speed require different working pressures. The low speed should be set at 40 psi and the high speed should be set at 35 psi. These numbers are printed on the maintenance instructions. The most important thing to do is oil both the low and high speed handpieces. We would recommend, as a minimum, this should be performed daily. Ideally, you could place 1 to 2 drops in the handpieces between every dental session. For the low speed and the high speed, you oil the same hole. This is the smaller of the 2 big holes in the back of the handpiece. After you apply the oil, connect the handpiece and run it for 5 to 10 seconds. This transfers the oil from the bottom of the unit into the turbine. We recommend Triflow, a Teflon-based lubricant. Simply replace the burrs by pushing the button at the back of the handpiece and pulling the burr out. If you have a lever lock handpiece, lift the lever and remove the burr. Both the handpieces can be autoclaved, remembering to oil them before and after autoclaving. The suction unit can be disassembled and the handpiece and tips can be autoclaved. The tubing is smooth bore and makes it easy to clean. All the handpiece lines are straight, making cleaning a breeze. The tip of the 3-way syringe can be removed and also cleaned and autoclaved. You must use distilled water in the dental machine. CLS can be added, and as I mentioned before, it is the only chlorhexidine solution available that can be used without blocking the dental machine. We send machines all over the world, so we need every machine to be trouble-free and easy to repair. All iM3 dental machines have a colour-coded delivery system, so in the unlikely event of a problem, we can easily identify it and send a replacement part. iM3 offers backup and technical support direct from the factory. All iM3 dental machines are fitted with easily replaced cartridge valves. Simply push the valve in and turn it a quarter turn anti-clockwise. The cartridge can then be removed and replaced with a new one, all in a matter of seconds. The silent compressor requires you to drain the condensation from the air tank weekly. The valve is located at the bottom of the tank. To do this, turn the compressor off, Drain air from the tank to reduce the pressure. Open the valve and allow the tank to drain. You'll need a tray to catch the rusty water. Once empty, close the drain and turn the compressor back on. We recommend a yearly oil and filter change for your compressor motor. The oil change kit comes complete with instructions. At the end of the day, turn the power off to your machine and release the pressure from the coolant supply bottles located at the back of the unit. I hope this presentation has been useful and informative. If you would like more information or to arrange a demonstration, please visit the iM3 website for your nearest distributor.